all that quad muscle goes down into connective tissue, kneecap, and then tendon, which attaches it to the lower leg, which is, well, why it can act on the lower leg. If you do too much in too short a time, or if you load it more than it can tolerate, so you get sort of a rupture or some sort of injury in the tendon. Ruptures are usually what you're bothered by in this area, unless you've got some sort of trigger points that constantly pull and tug that tendon that, well, never really leaves it relaxed, which might make you wear it out. Not in some sort of way that makes you old, degenerative, and never able to use it again. But if that's the case, get the meaty stuff to relax and then start loading the tendon to get it to heal. If it's some sort of rupture, kind of the same approach. This stuff should relax because the tendon needs to get some rest when you don't use it, and then load it to get it to heal. Load it, and well, generally kind of heavy. When we do have tendon troubles, we prefer to load them with negative exercise of some sort of, well, in this case, perhaps squats. And the point is to be able to load it so much, but without having to bother with the muscles. You want to load it, and it's kind of a stupid structure. It doesn't really know much. It's more of a rope. It just transfers the force from the leg down to the lower leg, and well, it doesn't really think much. It's just there, and you ought to load it. What we've seen with research is use the eccentric part of the exercise to be able to load it as heavily as you can, well, tolerate and manage. Do that for quite some time, and that seems to be what makes things heal as well as they possibly can. When you are bothered by tendon pain, tend to the muscle and find some sort of exercise to load the tendon just enough. It ought to be heavy enough for things to get loaded and to get the trend going forward, and well, easy enough for you to endure it. This part is generally tolerable for people. Just sit and stand, and when you're at this level, you ought to be able to do so quite often. Once this is tolerable or even easy, see how many you could do in a minute, 90 seconds, 2 minutes, to start challenging the muscles and the tendon. So just keep going, and once it's not really tough in any way anymore, it's, well, it doesn't feel as if it's bothering the tendon, it's not, well, you need something heavier. Start getting down on one leg, as we previously looked at. If both down and up on one leg is too tough, get down here and up on both. That way we actually try to focus on the eccentric part, as we said. If that's too easy, add some weight. And perhaps up on both. If you do have access to a gym, perhaps you might have a machine that allows you to simply load the extension of the knee. And if that's the case, get up with both. Let the wounded knee take all the weight on the way down. And then up with both and repeat. When you do that with a machine, you might very well accept that it's gonna hurt. You can take the load, and in a position like that, you're kinda in a controlled environment. So add some weight. When this tendon is injured and hurts, but it's not completely torn apart, it's generally kind of durable. So load it and let there be some pain. It shouldn't be completely intolerable, but, well, challenge yourself. If you don't have access to a gym, you might have to make things harder. Add more weight to the squats. Do one-legged pistol squats. So get down and up. Or, well, lift heavy stuff. Challenge the knee and the tendon, because that's what you're gonna, well, really have to do to get it to heal.